Hello, and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about males who have bladder leakage. So this is pretty uncommon unless there's like some other underlying medical issue. So let me explain why, showing you some anatomy pictures. So this is a model of a female pelvis. So let me show you the organs inside. So here's the bladder. And then here's the uterus, and they sit like this. So the uterus is on top of the bladder. So when women are pregnant, it's like all this pressure right on top of the bladder. And then from the bottom of the pelvis, women have a vaginal opening and the urethral opening and a rectal opening. So it's sort of like two openings in the muscle. So that makes the muscle inherently weaker. And then let me show you this picture. So this shows the male anatomy. So the bladder sits on top of the prostate and then the penis. So they have the opposite order of female anatomy. And then this is the anatomy, like looking from the bottom. So it's this view, female, male. So male, they only have one opening, and then the urethra is at the tip of the penis. So much less disruption in the muscles. So for those two reasons, it's much more common for women to have bladder leakage without any medical reason, even without pregnancy. But for men, it's usually based on like prostate enlargement or prostate surgery. So again, if we go back to this picture, the bladder is on top of the prostate. And so if the prostate gets bigger, it's gonna push on the bladder. So that's why in a lot of like older men, it's pretty common that the prostate enlarges or it gets bigger. They call it BPH, benign prostate hypertrophy, meaning it's not cancerous, it's just the prostate. Hypertrophy means growth. And so when the prostate gets bigger, it pushes on the bladder, so the bladder has to go more often. It can't fill up as much. So that doesn't usually cause bladder leakage, but just more like needing to go to the bathroom more often. What I see most often in men who have bladder leakage is they had prostate surgery. So the prostate becomes cancerous and they take it out. And often what happens is there's nerves in here that get disrupted. That's just super common in that surgery. I think there's no way that they can avoid it. And the other thing is, again, if you look at this picture, so the prostate and the bladder, they sit right on top of each other. And sometimes the, what we call the external urethral sphincter, it integrates with the prostate. And so sometimes when they take the prostate out, that leaves the sphincter, and so the sphincter is what keeps the bladder closed until it's time to go pee. So sometimes that sphincter is anatomically integrated, and so when they take the prostate out, again, if it's cancerous, they want to make sure they get all the cancer, and so that leaves the bladder sphincter a little bit weaker and it doesn't always close. So those are the men that usually end up in my clinic that have bladder leakage, and so they need to do Kegels, and lots of them, and it takes time. On average, we think it takes about 18 months to get full healing after having prostate surgery if you have bladder leakage, erectile dysfunction, things like that. There's a few other scenarios where men have bladder like dribbling leakage, and again, usually it's linked back to the prostate. And I would say for those men that just have like dribbling, usually it's like they're not completely emptying the bladder. So it's normal in men that some urine, this is the urethra, right? All the way from the bladder down to the tip of the penis. And so that's why men, you gotta like shake it a little after you pee. So that's normal that there's urine in here that has to like expel. But sometimes if the muscles are tight, so we're gonna go to this model now. So here's the penis, and then the rectum, and then these are the pelvic floor muscles. So if these muscles are tight, they often don't let all the urine expel, like empty out when you go to the bathroom, and then that's when you get a little bit of dribbling. So same thing in females, it's usually more tightness rather than weakness. So I would say like very, very infrequently do I see weak pelvic floor muscles in men unless it's related to prostate surgery. So again, the prostate surgery, when they take it out, it just disrupts the muscles and the nerves and leaves the pelvic floor muscles weak. But almost every other scenario of men, it's muscle tightness. And so that's what we got to work on. And we can talk about bladder urinary frequency in men in another video, but that's usually, again, related back to the prostate, and that's muscle-wise not a whole lot we can do about that. So that's a little bit about male and bladder leakage.